Hello everyone. Today I am going to discuss about the anatomy of the external ear. First we'll look at the basics of the ear. Ear is divided into three parts: external ear, middle ear, and the internal ear. External ear consists of three parts: pinna, external auditory canal, and the tympanic membrane. Now let us look in the diagram. This is a pinna. This is external acoustic canal or external auditory meatus. This is tympanic membrane. Inner to it we find the middle ear. This is middle ear, and we find the internal ear here. This is ear pinna. This is a cartilaginous part of the ear pinna. We don't find cartilage in middle. This is known as incisura terminalis. Now let us discuss about the middle ear. It is present medial to the tympanic membrane. See here. This is tympanic membrane, and medial to it we find the middle ear. It has three ear ossicles. These are malleus, incus, and stapes. We find eustachian tube, which is also known as auditory tube. It is a connection between the middle ear and the pharynx. Its function is to maintain the balance. When we come to internal ear, it is present medial to the middle ear. See, this is middle ear. Medial to the middle ear is present the internal ear. It is divided into two parts: membranous part and the bony part. We'll discuss about it in the coming videos. Now let us discuss the anatomy of the pinna. It develops from the first and second pharyngeal arches. The tragus part of the pinna develops from the first pharyngeal arch, whereas the rest of the pinna develops from second pharyngeal arch. Here we find the tragus. See here. This develops from the first pharyngeal arch. Remaining pinna develops from the second pharyngeal arch. Now let us discuss about the parts of the pinna. Lobule. Fat is present and the cartilage is absent in it. See, this is the lobule, where only fat is present. There is the absence of cartilage, which is the preferred site for piercing. Helix. Here, this is known as helix, part of the pinna. Concha. See, here we find the concha. This is concha. This is Symba conchae. Okay. Symba conchae is a cartilaginous landmark of the mastoid antrum. We find McEwen's triangle. This is an important triangle as is a surgical bony landmark of the mastoid antrum. See, here we find this is McEwen triangle. Okay. The boundaries are inferior temporal line, and it is present posterior superior wall of the ear. This is important because it prevents the damage to the important structures. This is here the incision should be given at the McEwen's triangle to prevent any damage to the important structures, like facial nerve is present. There are two types of incision: postoral incision or Willis incision. Pinna is retracted forward to prevent any hindrances, and the incision is given. Now we find another type of incision known as endoral incision. This is the area between the tragus and the helix. See here. This is tragus, helix. This is the area where cartilage is absent. See here. See here, cartilage is absent. This is known as incisura terminalis. Here incision is given, which is known as endoral incision. This is safe because cartilage is absent. It widens the external auditory meatus. See here, like this. Incision is given like this, and smaller surgeries are performed by this way. Skin on the lateral surface of the pinna is tightly attached to the perichondrium. See this. This is the lateral surface of the pinna. It is attached to the perichondrium tightly. Any infection causes perichondritis. If there is any injury, it may cause infection and can cause perichondritis. Okay. Any trauma can cause hematoma. This lateral surface of the pinna is very sensitive to the temperature and pressure changes. So when few people when they sleep towards the ear, towards their lateral surface of the ear, towards the pillow, they feel some pain as it is sensitive to temperature and pressure. Next, we'll discuss about the Darwin's tubercle. This is a projection present at the junction of the upper 1/3 and lower 2/3 of the helix. See, this is helix. This is junction of upper 1/3 and lower 2/3 of the helix. What does it denote? It denotes that we are the ancestors from the apes. Now let us discuss of the anatomy of the external auditory canal. It develops from the first cleft. It has two parts. Lateral 1/3 is cartilaginous part, whereas inner 2/3 is a bony part. The length of the lateral 1/3 is 8 mm, whereas the inner 2/3 is 16 mm. The total length of the external auditory canal is 24 mm. The function of it is it helps in transmission of sound from outside to inside. Now let us discuss about the cartilaginous part. The skin present here is thick. It contains hair follicles, sweat glands, sebaceous glands and ceruminous glands. Okay, so furuncles are common here. Furuncles are boils. It is lined by stratified squamous epithelium. It is very thick in cartilaginous part and very thin in bony part. There are ceruminous glands which secrete wax. So most of the wax is present in the cartilaginous part of the external auditory canal. Fissures of Santorini. These are present at the anterior wall towards the floor. See here. This is external auditory canal and we find fissures of Santorini. These are fissures of Santorini. Anterior wall of the towards the floor. This is floor of the external auditory canal. If there is any infection of the external auditory canal, otitis externa can lead to passage of this infection towards the base of the skull, can cause skull base osteomyelitis. Any infection can pass into the base of the skull through fissures of Santorini and cause skull base osteomyelitis. Or else it can enter into soft tissues like parotid gland and can cause parotitis. Next, the narrowest part of the external auditory canal is known as isthmus. It is present deep inside. It is present at the bony part. It is present 5 to 6 mm lateral to the tympanic membrane. If there is any foreign body gets deposited in isthmus, it is very difficult to remove. So we should be very careful. If any foreign body goes medial to the isthmus, it is very difficult for us to remove. Beyond the isthmus, we find the dilatation in the floor known as meatal recess. What is it? Meatal recess. If there is any pus from the middle ear, it is collected here. Next, foramen of Husky. These are openings present in the floor of the bony part of the external auditory canal. So we find two foramens. One is foramen of Santorini in the cartilaginous part of the external auditory canal, whereas foramen of Husky we find in the bony part of the external auditory canal. This also can cause skull base osteomyelitis if there is an infection in the bony part. Next, external auditory canal is a S-shaped canal. Outer 1/3 is upwards, backwards and medially. Cartilaginous part is upwards, backwards and medially, whereas inner 2/3 is downwards, forwards and medially. If you want to observe tympanic membrane, we have to pull the pinna posterior superiorly. See, like this. We have to pull the pinna upwards and backwards and we have to observe. This is about the external auditory canal. The next part is tympanic membrane. We'll discuss about it in the next video. Thank you. Please like and subscribe.